Hello, I'm Dr. Bandari, consultant hand, wrist and microsurgeon. Today we have Shaik Ismail. He is a student from Guntur, but he is doing his education in Canada. So I think about 4 months back, he sustained a fall from the bike in Canada itself. He has taken preliminary treatment in Canada, but the treatment wasn't successful. Then gradually he researched and came to us in Hyderabad for the treatment. Once we saw Ismail, we told him that one of his ligament in the wrist is broken and we need to repair that. And after a lot of counseling and talking to each other, he has opted for surgery. And he had certain financial issues, and so also we tried to help him in that way, and we finally operated Ismail. Now it's been about less than 2 months after surgery, Ismail.
Yeah.
So Ismail is back to us. We have seen him today, and we have seen that he is recovering in a very good manner. So we'll know from Ismail how he is doing and what are the results after this minimally invasive surgery which we have done.
As the doctor explained each and everything, I was having this journey was almost started 50 days before, and the moment I met him, he's the only one who I think that his diagnosis made me to opt him when I compared with other doctors. And the moment I see him, I felt pretty confident that he's the only one who can fix me up blindly. And after that, I just put my hand in his hand so that he is the only guy who can treat me up. And after that day till now, I never looked back for taking this decision, and I'm pretty much happy for what I had taken this step. I know it's not that easy for all the guys to take the decision to undergo a surgery, because there might be certain speculations that might be coming up after surgery. We may not able to be recover, and this is not the old fashioned way if you need to recover it that faster. But I was also the same guy who thought of all these things, but eventually came up after having multiple sessions with him, like what will be the recovery manner and stuff. At the end, I opted for the same what these dudes suggested me, and at the end it worked very well for me, and now I'm pretty much happy for choosing this. My damage was eventually, I don't know in the beginning what the damage was, but he diagnosed me properly in his own methods, and then he found out there is a TFCC tear inside. And then eventually we went for MRI scans and everything, and it ended up the same way where the doctor has been guessing this would be the damage too. And after that, we opted for arthroscopy, which is a minimally invasive surgery where I just had one stitch in this and some multiple 3 to 4 invasions inside. And after that, we had a slab which immobilized my hand for like good 40 days, and now my hand movements are pretty fine. I think I'm recovering pretty much faster than expected. Even my wrist rotations, they are pretty good. So far, yeah, all the movements are coming up fine. Only one thing, we are having this supination or pronation. I'm not sure with the terminology, but eventually we'll get there, I think, in next couple of weeks.
Yes. So what we have seen is that compared to what we anticipated, Ismail is recovering on a still faster pace than what we anticipated. That means the surgery has been done very well, and he's also healing in a very well. He's been a very wonderful cooperative patient from the beginning, and when we are very happy that we could do such a surgery, minimally invasive and very comfortable surgery to him.
I would like to add one more thing. He has a very good team on top of his treatment to begin with. The physio care what I'm getting is unremarkable. These dudes are watching me very closely, and even if I'm putting it aside, they're forcing me that you have to go through this because it works only on the both ways. So I'd like to thank his physio team too. Dr. Akhil is having special care on me. He's aiming more than me to make my recovery faster so that I can plan my journeys and studies again. And I thank Doctor too from bottom of my heart. This journey wouldn't have been possible without his confidence and all his guidance. On top of it, whenever I was undergoing all these surgeries, I think Apollo hospitals and their management is also pretty good. Starting from my admission to post departure, they treated me very well, and wherever I have been changing the rooms, there are people who are watching me and guiding me through each and every step. And I would say one of their hospitality management is also on top of the box, which made me to choose this.